Hi, my name is Beth, and I'm going to be your nurse today. I'm here to give you a head to toe assessment. Can you tell me your name and your date of birth?
Kevin Barfield, 116073.
Do you know where you are, Mr. Barfield?
Home.
Where are you at, Mr. Barfield?
In Rock Hill,
Okay. Do you know what year it is?
2021.
Who is the president?
Biden.
Okay. So the first part of my assessment, I've already taken your vitals. So your blood pressure was 120 over 85, which is good. Your pulse was 67, which is also good. You had a temperature of 98.2, which is perfect. And then your respirations were 14, which is right on par. And then your O2 saturation was 100%. Do you have any health conditions that we need to be aware of before we start? Any history of diabetes, high blood pressure?
Diabetes.
Okay. Any family history?
Blood pressure.
Okay. Who has that?
Everybody but me.
Okay. And any cancer?
Grandmother on my mother's side.
All right. Any histories of the communicable diseases? Hepatitis, HIV? No? Okay. So the first thing I'm going to have you do is I'm going to have you put your arms to your side, and I'm going to have you take off your hat. So what I'm going to do is I'm going to go ahead and I'm going to examine your head. All right. Can you do me a favor and could you go like you're blowing up a balloon? Go. Okay. Stick out your tongue. All right. I'm going to look at your eyes. Your eyes are equal and reactive to light. Can you put your head down to your chin? Okay. Now I'm going to assess your lymph nodes. Note that there are no swelling. Any pain when I press down? Okay. So I'm looking at your arms. I'm going to feel both. You have a pulse times 1, which is good. Go ahead and take my hands. Squeeze them. I want you to put your hands flat and try not to let me push. Okay, he's got equal and reach strength bilaterally. Now I'm going to go ahead and lift up your chest. Lift up your shirt to see your chest. I don't see anything in the abdomen or anything on the chest. That skin-wise, your skin is intact. Now I'm going to go ahead and listen to your breathing. So I'm also going to listen to your heart rate. Where I'm going to listen, I'm going to go to the 5th intercostal rib, right mid-sternal. This is for the apical pulse. This gives us the best reading of what your heart rate is. Your heart rate sounds good. So now I'm going to lay you flat. I'm going to listen to your belly. Okay? What I'm looking for in your stomach is I'm listening to hear if you have if you have bowel sounds. And then I'm going to feel and palpitate your belly to make sure that there's no pain and that it's all equal. All right. Does this hurt at any time?
No.
Okay. Alright. Now lastly, I'm going to take a look at your legs and feet. We're going to see both of your legs. I'm going to feel for a pedal pulse. A pedal pulse is your pulse that is around your ankles. It's part of... Alright. In both legs. I have good pulse, no swelling. Go ahead. All right. We're going to check your range of motion. Okay, can you go ahead and bend your knee? All right. Did this one? Okay. And then we also do your range of motion in your arm. Go ahead and bend. So do the other side. Well, Mr. Barfield, you are healthy, and I'm going to give you some education. Upon looking at the labs, the doctors recommended that you see a physician for your diabetes. It's very important that you monitor your blood sugar on a daily basis, you eat a proper diet, and that you get lab work at least every 3 months to monitor what's called an A1C. The A1C is the 3-month level of your blood sugar. This determines whether you are a pre-diabetic, a diabetic, or if we need to put you on any type of medications, and it helps to monitor those. Do you have any questions for me before the doctor comes in?
Nope.
All right. Thank you, Mr. Barfield.